Kurt Vesnick. We appreciate you being here today for the Tuesday doctor's call that we have every Tuesday at noon Eastern Time. I understand today we're going to have a guest speaker. Dr. Kim Schunkweiler will be joining us. And Dr. Kurt is from Fargo, North Dakota. He has been a licensed chiropractor for over 30 years. Dr. Kim Schunkweiler is from near Detroit, Michigan, and he has also been a chiropractor for over 30 years. So today they will be bringing some of their expertise to share with us about how to be healthy, get healthy, stay healthy, and we welcome you to the call.
Hey, well, thanks, Andrea, and thanks everyone for taking the time out of your day to join us. You know, like Andrea was saying, I've been doing this for over 30 years. Dr. Kim's been doing this for over 30 years, and you know, it's amazing what we're finding out, and the new things that we're finding on nutrition and disease and really, you know, I'm going to say disease prevention because that's in my opinion that's the key to all of this. I'm just going to read something. You know, today I want to talk about Alzheimer's. I want to talk about dementia, and really they're saying the Alzheimer's Association said it's a non-curable disease, and as we age, as the population of the United States ages, we're just going to see this disease go on the rise. According to the Alzheimer's Association, by 2050, they're estimating that the number of patients with Alzheimer's will triple from where it is now to about 16 million people. And that is a huge number, but think about the cost of taking care of these patients, and it could devastate a nation. And so that's one of the things that we're one of the reasons why we're seeing so many scientists and drug companies trying to come up with an answer, because they really want to help prevent this, and that's the key to it. And so it's bad. Before we get the call started and really kind of get into the meat of the call, I thought what I'd do. A friend of mine, a good friend of mine, her dad got diagnosed with Alzheimer's really early on. He was in his 50s, and I asked Katie to record her story.
Share my story about my father.
So I'm gonna play that.
Larkin. He was diagnosed with early onset Alzheimer's at the age of 54. A bit about my dad. He was always the life of the party. He was a big jokester. You know, if you'd yawn, he'd like to stick his finger in your mouth. He'd have a t-shirt that'd say, "No flies on me, mate," and there'd be all little flies, you know, drawn on the t-shirt. He loved sailing. He had his own boat. He loved swimming, bike riding, exercising, and he loved his veggies. I guess it began in 1997. It was my 21st birthday, and we went to the Maryborough Resort in Victoria, Australia. We were having a really good time, and we were in the, I guess, entertainment room or leisure room, whatever you'd like to call it, and we were playing pool. And I was there with a friend, my brother and a couple other friends, and we started the game of pool, and I think we had the first go, and then my dad went second, and when he went to hit the ball with the cue stick, he hit the black ball and potted it. And we turned to him and said, "Dad, what are you doing? You don't hit the black ball, that's for last." And he didn't realise, or it didn't register to him. So I guess that was the very first sign that we all remember, and that was an alarm bell going off, but we just thought maybe there was some reason for it. So I'm going to go through chronological, snippets of the timeline from this point on to the last point. And these are sort of how I remember it, just kind of snippets in my mind. It's kind of difficult to piece the story together, but anyway, here goes. So fast forward 1 month from the time of my birthday, Dad was coming home most nights crying. We didn't know why, and he went to the doctors. The doctor said he had clinical depression. We were all very sad. At this time, one day we drove to pick Mum up from work. He couldn't remember how to get to her work. I screamed at him, "Don't you know what you were talking about? These are the wrong directions." To this day, I still regret it. It sits heavy in my heart. Why did I have to yell? The depression progressed to the point that he was getting in trouble at work. His boss tried to fire him. The union stepped in and fought. He was paid out. Financially, things started to fall down around him. Over the course of the following year, they said that he had early onset Alzheimer's, and that's what was causing his depression, not the other way around. Desperate for answers, we started looking for solutions and possible causes. I remember thinking there is no cure that we are aware of at this time, but I'm sure that I will know of one at some point in the future. However, that is no good to me or us now, or him. He started to lose his ability to draw. I remember asking him to draw a house, and each month he could draw less and less of a house, till eventually it didn't represent a house. It was being erased, like his memory. One day we were handing out flyers for an election campaign for my mum. He was trying to speak to people and just mumbling words, saying, "Oh, look at the bzz bzz, beep 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 beep." He didn't make any sense. I felt kind of embarrassed. He then lost his ability to know where the toilet was and ended up going outside in the driveway. It all became too much for Mum, and she started looking at nursing homes for him. Hiding behind the clotheslines and the sheets, you could see his eyes peeping around the edge of the sheet, saying he didn't want to go. He was too scared to be put in a home. Sitting in a nursing home with 80-year-olds, my 56-year-old father at this time. He was 56 years old, sitting next to 80-year-olds. His young face next to others 30 years his senior. This picture is so wrong. Jumping the fence, trying to escape from the nursing home. Changing facilities. He was then admitted to a psychiatric facility for care. Alzheimer's patients are classified as having a mental illness and treated as such in a psychiatric facility. He was then put on clinical trials, Lilly Pharmaceuticals. I remember taking him to the toilet and helping him to wipe. He said to me, "How embarrassing," even though he hadn't spoken for a long time. The drug trials began. Against our wishes, we were powerless. Lilly Pharmaceuticals were testing schizophrenic drugs on Alzheimer's patients. He was climbing the walls, literally, on a chair, trying to climb on the back of the couch and go up the wall. His edema got so bad he couldn't stand. Side effects of all the drugs. The horror of being alive and tortured. sitting in the office of the head psychiatrist, crying, begging him to stop, and asking for my father to be released. He was refused. My world was black as night, and I wasn't sure how the light could ever come back, and how long this would go on for. Now he was a prisoner to torturous drugs that were worse than the disease. The psychiatrist said, "He knows nothing, his memory is gone, he didn't even recognize me." Why would he recognize the psychiatrist? The battle began. We were fighting his disease and the establishment. Armour up, we fronted up to court. I remember thinking it's like a starving dog with a bone, we're not going to let this go. Look out, you beep beep. You won't beat us, we will fight to the end. Jump forward, fighting with the nurses. Nurses restricted our access, they made up lies saying we would hurt him because we complained too many times. Looking out the window at the oak tree, knowing this moment would pass and one day all this would be gone. Being an observer, and then changing position to being him. Battling in court over a 5-year period. Then 3 lawyers and 10 family members were in the court. They were not going to win. They gave up and released him. The day he was released, he said, "I'm going home," and started crying. He came home. We set up the house to accommodate him like a disabled patient. We built a ramp at the front of the house, a lifting machine to move him around, a wheelchair, showered him in a blow-up bath. His memory came back when he came home. With no more drugs, he recognised our faces and was able to laugh. I danced for him to make him laugh. He couldn't talk, walk, or move by himself. He lost the ability. Fast forward. He then lost the ability to swallow. We stopped feeding him. He was given morphine. The countdown began. The end was imminent. He opened his eyes before he died. He looked at us with tears in his eyes that rolled down his face. I said, "Don't worry, Dad, I'll see you on the other side." Took his last breath and gasped. He passed away at home on August the 2nd, 9:30 a.m. 2004. 7 years from diagnosis to death. It was a fast and aggressive disease.
You know, I listened to that recording earlier this morning, and how can you not just break into tears thinking about it? You know, when you're your own father at that young age, and so it really is a disease that if it's gonna be on such a rise, like they're saying, 16 million people in the United States, 16 million in the next 30 years. That's huge. That's a huge number. And right now they say that it's incurable. You know, maybe we'll come up with something in the future, but really, in my opinion, Dr. Kim and I were talking this morning, the cure is prevention. And so Dr. Kim, if you want to hit *6 and unmute yourself, talk a little bit about this new diagnostic lab test that you've been keeping track of for a while here. Talk a little bit about that and what it can mean.
Well, thank you, Dr. Kurt, and thanks for asking me on this morning. It is a terrible disease, and you're absolutely right. The best way to not deal with it is just don't get it in the first place. So there is a new test, and it's not quite available yet, but it will be soon. But what they found is there's a peptide. It's beta amyloid 42. And it's produced everywhere in the body. And what they found is that even at an early age, as early as 15, 16 years old, that if that peptide is elevated, it is a prime indicator that you're going to develop Alzheimer's. Because that peptide, when it's elevated, accumulates in the neurons in the brain and causes Alzheimer's, what we call Alzheimer's. So this new test it's actually a saliva test, and you'll be able to just right now just get a saliva sample, and that peptide can be analyzed and determined whether you have an elevated amount. So you'll know whether you're a candidate for Alzheimer's or not. And at that point, yeah, go ahead.
Oh, I was just going to say, Dr. Kim, I'm just imagining what people are going to say. They're going to say to you, they're going to say, Doc, but why do I want to know about it early if there's no cure?
Well, at this point, there is no cure. Once that you have that accumulation of peptide, which causes inflammation in the brain. But if you know, you can be, like they say, forewarned is forearmed. You can start doing simple things that will prevent that from happening. They're actually recommending that they found that if just taking a simple ibuprofen daily can prevent it.
You know, Dr. Kim, when you and I were talking about that this morning, you know, you and I started thinking, well, if taking a simple ibuprofen, an over-the-counter anti-inflammatory drug like that, can work, why couldn't there something natural? So, what's your thoughts on that?
Well, I'm very uncomfortable recommending that people take ibuprofen every day for the rest of their life. I think there's side effects from doing that. You know, then you're creating digestive problems and liver problems and other things. So I think there's a lot of advantages from finding natural substances that can, you know, take the place of these drugs. Or you know, ibuprofen's a drug that comes with side effects. So you quickly found some answers right off the bat. You know, that was cool. I mean, there's things we can do every day. You know, maybe a lot of us that are on the call are doing already, but you know, simple things. And go ahead and why don't you talk a little bit about what you found while we were talking.
Yeah, you know, the one thing that when you brought up the taking the ibuprofen, which I was unaware of, when you brought that up, I thought, well, if ibuprofen works, why can't we do other natural anti-inflammatories? So I just kind of, while we were talking, you know, for you guys that are on the call right now, this all happened a couple hours ago. I jumped on the internet and I thought, well, there's got to be something natural that'll work like the ibuprofen. And sure enough, here's a study from the American Journal of Geriatric Psychiatry, March 2018. So we're talking about a study that's not even 6 months old yet, or just 6 months old. And they said, here's the title of the article. It says, Memory and Brain Amyloid and Tau Effects of a Bioavailable Form of Curcumin in Non-Demented Adults, a double-blind, placebo-controlled 18-month trial. And they went through, and this was the first time that they did a study, and they used a highly bioavailable form of curcumin. And they did 90 milligrams of curcumin daily, twice daily. And they found that this daily oral dosage led to significant memory and attention benefits. And on PET scans, pre and post treatment, they said that there was behavioral and cognitive benefits associated with the decrease in plaque and tangle accumulation. So these are the accumulations that Dr. Kim was talking about that this saliva test detects, right? So they went on to say that that the curcumin has a property, an anti-inflammatory property that help protect the brain from neurodegeneration, and it had an impact on the amyloid and the tau accumulations. And I can go through the whole study here and everything, but I know that most of you don't want to hear all the science and all that. You just want to know, hey, you know, does this work? And so they said that laboratory and animal studies indicated that the curcumin's potential effect on the amyloid plaques and tau tangles were evident on this study. And they said that the binding values in the selected brain areas are significant higher in Alzheimer's disease than that in the healthy aging and mild cognitive impairment. So it's showing some promise. And so I'm just reading through this and all of that. But the other thing is that, so, you know, curcuma longa is considered to be one of the most bioavailable forms of curcumin, and that's what we have in our brain vitality product, the Sizzle Brain Vitality products. And we can't say, look, we've got a cure for Alzheimer's. Look, we've got a preventative cure for Alzheimer's. But we can say, here's a study from March of 2018 in the American Journal of Geriatric Psychiatry that says that curcumin may be of benefit, and we've got the most bioavailable form of curcumin, which is the curcumin longa, which is found in brain vitality, and so I would really highly recommend that, and there's other things that are in the brain vitality as well. We've got a very bioavailable form of magnesium called magnesium threonate. And the thing that distinguishes magnesium threonate from other forms of magnesium is that they found that it passes through the blood-brain barrier. You see, your body has kind of built a wall, right? They built a wall to prevent bad stuff from getting in. And so the by doing that, it sometimes prevents good stuff from getting in as well, because it's just the way the wall is built. But the magnesium threonate passes through the blood-brain barrier through this wall, and it can help with inflammation as well. And so, Dr. Kim, that leads us to the next thing that we talked about. You know, a lot of scientists over the last couple of years, they've said that Alzheimer's is really type 3 diabetes. And so what's your thoughts on that, and what kind of a diet would you recommend for somebody who might come back positive with having some of these indicators saying that they're high risk?
Well, and as we talked, it's why all of a sudden are people getting such large numbers of people getting Alzheimer's, and it's got to relate back to a crappy diet that we have. We eat a pro-inflammatory diet, lots of refined carbohydrates, junk, So, one of the simple things that we could probably do is get on an anti-inflammatory diet. Something like a ketogenic diet or a low carbohydrate, especially refined carbohydrate diet, could probably go a long way towards helping. Lots of things, not just the potential onset of Alzheimer's. So there's another reason to get on a good diet, to help prevent that. So that's a simple thing. About just not, I've been around 67 years, and after a while you get used to eating a certain way. It's hard to change. And for most people, it's very difficult to change diet, but you can do it. You can do it, and you feel better when you do it. So not only you start preventing Alzheimer's, but also diabetes and obesity, things like that, which can cause all kinds of problems. So really important.
Yeah, here's another study. This one is another interesting study, Dr. Kim. It comes from Brain Research, January of this year, January 2018. So it's a 9-month-old study, and what they say is type 2 diabetes is a risk factor for Alzheimer's disease, and they're saying that if you can lower these peptides and these hormones, and you can keep the body from getting the inflammation like Dr. Kim was talking about, you can help with reducing the amount of the beta amyloids. You can reduce the neuroinflammation which is activated microglia and astrocytes, and wow, astrocytes. Dr. Kim, I just thought of this. What's the other thing that you and I know about astrocytes when we're talking about PEMF therapy?
You caught me.
I caught you. Oh man,
Yeah,
that's a first.
Yeah,
That's
my mind just went blank there. I mean, go on.
Astrocytes are the only cell in the human body that produce magnetism.
Oh yes.
Right? It's the only cell in the human body. And so here they're saying that this neuroinflammation causes problems with the astrocytes. So we've heard that the pulsed electromagnetic field therapy, the PMF therapy, was beneficial for people that had Alzheimer's. I'm just putting this together in my head. So folks, if you're listening, it's not that I've read studies on it. I'm just kind of putting 2 and 2 together in my head as I'm talking about it.
Well, I've had really good results over the years with people treating people with depression with the PEMF machine. So now we're putting some stuff together. And I've actually had a few Alzheimer's patients over the years that we've treated their head with the PEMF that have shown really good improvement, and also Parkinson's disease. So maybe you're onto something there, my friend.
Yeah, I mean, and it was just I happened to read this on this study from January of this year, and so they go on and they talk about all this. But anyhow, folks, that's another thing, I don't want to get into right now. But, when we talk about Alzheimer's and we talk about an anti-inflammatory diet and a ketogenic diet, Dr. Kim, when you're talking about a ketogenic lifestyle, ketogenic diet, can you tell people, or maybe this is where we need to bring Andrea in, because I know, Andrea, you've been kind of looking at the ketogenic diet. Tell us a little bit about what your thoughts are on how do you change a pro-inflammatory diet to a ketogenic diet?
Sure. I've done quite a bit of research on that, and actually what I've learned is that, we've discussed this before on the doctor's call. When you are a sugar or a carb burner, it requires insulin for the brain to convert that into a power source. And if you are a fat burner, you don't need insulin for that. So that would contribute to that, what they're calling type 3 diabetes, being Alzheimer's or dementia. So basically, the ketogenic diet is switching from being a carb or a sugar burner, which in my opinion is not our natural state, to being a fat burner. So in your diet, you would intake about 75 to 80% fat and 5% carbs and about 15% protein. And that would put you in a ketogenic state where you would be burning fat for fuel. So not only the fat you intake, but fat off your body, which I believe is one of the big contributors to 60 years of yo-yo dieting, is people, being told that fat is not good for them, and that, we have this access to all the carbs, which we talked about a couple of weeks ago on the call. I did want to also mention that when you're in ketosis, or if you're doing a keto diet, that also greatly reduces inflammation. So again, we have this circle of activity that is beneficial to the body. I do know of a report that people can look up that's I found quite interesting. If you go to YouTube and put in Dr. Mary Newport, or you can put in coconut oil and dementia, her videos should pop up. She is a neonatal nurse in Florida. Her husband developed dementia, quite badly. And they have a whole video about him on there that a news channel did on him, and how she started putting healthy fats in his diet. And within a very short period of time, it like started reversing his dementia. So that might be interesting information for people to look up.
So it actually showed that it reversed some of his dementia.
Oh yeah, quite significantly and quite quickly. Like Katie's sharing her story about her dad trying to get him to draw something. In this particular video, they took him in for evaluation, and the doctor asked him to draw a clock. And so it showed how he drew the clock. It was just this squiggly line and kind of marks all over. It didn't look anything like a clock. She started putting high amounts of high-quality, non-refined coconut oil in his diet. And I think it was 2 months later they went back and had him redraw a clock, and he could draw a clock.
Wow.
He was in a point where he couldn't take care of himself in the home. She had to have people come in and help. And that he reversed so much that he is now able to function in the home, do all the normal things that he would, like prepare his meals during the day, things like that. So, yeah, it was quite significant.
Yeah, it really is. You know, Andrea, when we're talking about, you know, coconut oils and healthy fats and things like that, you know, I really like bringing up the Super Omega product that we have. You know, it's got not just the omega-3s. So many products out there, they have the omega-3s, but they don't have some of the other things. And I've got some people that have told me in the past, they'll say, oh, yeah, you know, I'm using flaxseed. And the problem with flaxseed is that it has high amounts of EPA. It's a type of oil that's found in the healthy fats, in the omega-3s. But it doesn't contain any of the DHA. And the DHA is the particular fatty acid that's found in fish oil that you can't get with flaxseed oil. So there is a difference with different kinds of oils and things like that. And so when we're talking about that, you know, I look at that, and we've got omega-5, we've got omega-7, we've got CoQ10 in there as well. So I take that every day. I just, you know, I believe in it so much. I'm being honest with everybody. I give it to my dog. I pop the pill open and squeeze it into his food, and he gets that as well every single day. My black lab does. But you know, and when we're talking about, you know, you're talking about the ketogenic diet, talk about percentages and things like that. You know, so I think that a lot of people, when you say low carbohydrate, they automatically go, oh, you know, I'm not using any sugar.
Right.
And they just think that, oh, I'm not adding any table sugar to my food. You know, I'm not eating any cookies. I'm not eating any ho-hos and things like that. But when we're talking about carbohydrates, what do you mean? Do you mean everything? Like celery, lettuce, tomatoes, everything, right?
Well, like we brought up, I think it was last week or the week before, you know, there's different, what is that term? Like carrots are high and
Glycemic, yeah.
Yeah, the glycemic index. So yeah, basically all carbs, all vegetables and fruits are carbs, right? If they're not considered sugars outside the body, once they go in the body, I believe you've shared that they convert into a sugar in our body. So they are. So you would stick more with like green leafy vegetables, and I mean, finding keto suggestions right now is so easy. You can download apps on your phone, you can Google it, you can YouTube it. There is a whole world of people doing keto out there and having fantastic results with it and great health improvement. So it's pretty easy to find and follow a keto diet.
Dr. Kim, you know, when we're talking about the ketogenic diet, yesterday I read a report that, you know, of course, you always have the people that say, oh, ketogenic diet's really good, it's really good, all these things are really good. And then all of a sudden you have another researcher who said, oh, it's not good. And so yesterday I read a report that said a ketogenic diet is bad for somebody who's had a previous heart attack. What's your thoughts on that?
I'd like to see a lot of research on that, because I know there's a lot of cardiologists that are big proponents of ketogenic diet. I think people do better. I mean, it only makes sense. I mean, if you go back to, thousands of years ago when our digestive systems were developing, what did our ancestors eat? I mean, they didn't have wheat because that has to be processed, right? So they eat basically animals, roots. Fruit back then was a lot different. It wasn't bred to be full of sugar like it is today. So I think our digestive systems were designed to basically be ketogenic. We didn't have the access to carbohydrates. We had primarily fats and protein. When they do archaeological studies, they find campsites where a lot of our ancestors were. They'll find that all the bones were smashed so they could get at the marrow, which is high fat, high energy food. For every gram of fat, you get 9 calories. For every gram of protein, you get 4. For every gram of carbohydrates, you get 4. So fat is very high energy food,
Exactly.
which leads to increased survival, right? So to me, it only makes sense. It's just, we started raising grain and things changed. We started refining sugar in our, and it's like poison, millions of people have died because of that, so, or had less productive lives because of it, but much shorter. So that's what I think about that.
Yeah, I agree with you. I think that I mean, a number of years ago, I'm going to say back in around the early 2000, 2001, I remember reading a study that, they said, oh, vitamin E is bad for you. Vitamin E causes heart disease. And I thought, oh my God, really? How can they say that when all of the previous studies that I read said that vitamin E helped prevent heart disease? And so I went and actually read the study. And the study that said that vitamin E caused heart disease, guess what they used, Dr. Kim? They used a synthetic form of vitamin E in their study.
Right. Guaranteeing bad results.
Yeah. You wonder why why do they do that? Why do they try and manufacture the idea artificially that way?
Well, I hate to say this, but as the older I get, the more cynical I get, and the more I realize that old saying is true. Follow the money. Because that's always where it always leads to the answer, right?
Yeah.
Yeah, I would agree with that. I think that there's a lot of companies out there that are putting out products where they're lining their pockets with people's health. And actually, I think they put out disinformation. I remember like a couple years ago, everybody was spouting the benefits of coconut oil, and suddenly across my social media page come all these little ads about how coconut oil is bad for you, and it was just disinformation, so that would confuse people.
Yeah.
Well, a lot of people make money off people being sick, right?
Correct.
Well, and conversely, with people make money off of people being healthy too, to get healthy, But
personally, I would rather help people be healthy than help people be sick.
Well, there is that dichotomy, isn't there? And people on this call, I think, are all in your category that see the benefits of helping people stay healthy as opposed to trying to help them get well, which it's harder to do. So, not that it can't be done, but it's harder to get healthy than to stay healthy.
Yeah. Yeah, prevention. I remember, it was a long time ago. They told us that for every dollar that you spend on prevention, that you're going to save $5 in future health care. So it's a good investment. It's a good investment, when you think about it.
Yeah. Absolutely.
Not to mention pain and
You know,
suffering.
let me mention, I have a dear friend who has is really into the ketogenic diet, Dr. Linda Huxtable, and she has a website, I think it's called the Keto Clean Lifestyle, and she has a lot of information on there about ketogenic diet. So if you feel like you'd like to learn more, you can check out her website too.
You bet. And Linda's involved with us with the H pill and Sizzle as well.
Yes, she is. Yes, she is. And it might not be a bad idea to get her on a call here some week to talk about it, because she's excellent.
You know, do you want to get a hold of her and see if she'll be on the call next week?
I will do that.
All right.
I'll do that.
Well, folks, you know, thanks for being with us. I know I went overtime a little bit here by 10, 11 minutes, but, you know, I think it's an important topic. And the important thing is like Dr. Kim and Andrea and I are talking about, is that it's a lot easier to prevent something from going wrong than it is to go back and treat it. And it's a lot cheaper. I mean, obviously, you know, if you're saving $5 for every dollar you spend, prevention really is the answer. And when we're talking about Alzheimer's or we're talking about cancer, prevention really is the cure. And because there's no known treatment for it. You know, I mean, sure, there's things like Andrea's talking about with the coconut oil, but once you have it, your risk of having further problems are there. And like Katie shared with her father, I mean, oh my God, I mean, how can you listen to that and not get tears in your eye? And you think about it. I mean, think about, what if that was your dad and you watched him just kind of slowly fall apart and your life around him slowly falls apart. And I'm real close with my parents, and I think about that, and it's like, you know, we got to do everything that we can. So Andrea, I'll let you close out the call, but Dr. Kim, is there any final thoughts that you have that you want to share with everyone?
Well, I am putting together a website for the saliva test, and it's not up yet, but it will be AlzheimerSalivaTest.com. Not Alzheimer's, but Alzheimer saliva test. So there's not two S's together. And the test will probably run around $300, but then you'll know. So I'll throw that out there just in case you want to check on that every so often when I get it up and running. This is brand new stuff, and we're just putting it together. There will be a test come out probably next summer sometime. That'll be basically like a dipstick test. So you'll be able to just put the test stick in the saliva, and you'll know immediately whether you're a candidate for Alzheimer's or not. And that'll be exciting. So stay tuned for more information. Yeah.
And I think that test will be so important because you can do it right at home, and then, you know, it's not something to put the fear of God in you. What it's designed for is to put you into that right state of mind that you're going to go look for prevention. And that, I think that's the key. That's the key.
Exactly.
Andrea, we'll hand it over to you.
Thanks, Dr. Kurt.
Thanks, Dr. Kim.
Well, you know, Kitty's story about her father is absolutely heartbreaking. I just sat here with tears rolling down my face. And I can't imagine having to deal with not only how heart-crushing that was, but to deal with what we term now medical kidnapping of her father, and having to go through all of that struggle would be doubly hard. So my heart goes out to Katie and her family. We did mention some products today: Brain Vitality, Omega Plus, Dr. Kim, Dr. Kurt, myself, and several people, and probably the person who invited you to this call, are connected with a really awesome company called Sizzle International, where we have a biochemist as the head of that company who has been making very effective non-toxic products with the highest quality and standards for 30 years. So if you're interested in looking at some really good preventative supplements, get back with your friend that invited you to this call and just ask to look at their website or provide you with some videos about any information that you're interested in, and I'm sure they would be glad to do that. Thank you all for joining the call this Tuesday. We look forward to having you join us again next Tuesday at noon Eastern Time. Have a great day.